So you're massaging your instep from kidney 1, which is the hollow underneath the ball of the foot, all the way up to kidney 2, which is halfway up the instep. And you're going to massage that approximately 9 times. Okay, switch feet.
9.
So kidney 1 and kidney 2 are actually more involved with diabetes than the spleen, which is what most people make the assumption, that diabetes has to do with the spleen, because the pancreas regulates blood sugar. But as we all know, with diabetes, blood flow is restricted from the feet and the hands. So if we want to reverse diabetes, we have to increase blood flow to the feet and the hands, and that's why we do this particular exercise. Okay, 90 degrees to the side, and there we go. And now right hand is going to push, pinch pull the little toe, then the 4th toe, then the 3rd toe, all the way up to the big toe, and then you're going to go back down each toe to the little toe.